My name is Sadat Rashid. I'm a clinical and an interventional gastroenterologist at Goshen Health. I work in the Department of Gastroenterology and Hepatology in the Digestive Disease Center. I chose a gastroenterology and advanced endoscopy because this offered me an opportunity of both the clinical aspect of treating patients as well as doing a minimal invasive surgeries through endoscopic procedures. I deal with a lot of gastrointestinal cancers in advanced endoscopy and also deal in the preventive aspects of the cancer. That includes like screening colonoscopies, screening for Barrett's esophagus, as well as doing advanced interventional procedures, helping in the staging and the treatment of gastrointestinal cancers. Basically, we see mostly adult patients more than age 18, and they vary from all gastrointestinal diseases, including from acid reflux, colon cancer screening, liver disorders, cirrhosis of patients, and gastrointestinal cancers. That includes pancreatic, bile duct, liver, colon, esophageal cancers. It's up to a primary care provider to establish when they need to refer it to us, and that can vary from provider to provider. They can refer us anytime they feel that they need a second opinion or have a diagnostic dilemma. If they have any questions regarding any workup, they can ask us, but usually what we try to do is when patients comes and sees us, then we complete any workup that is needed for the diagnosis of the patient. We pretty much do all the advanced endoscopic procedures and treatment that is available anywhere in the United States. As far as I know, I'm the only one in the area who provides the technique of water immersion colonoscopy and underwater resection of polyps. The advantages of that is multifold, which is one of them is it is cause the least discomfort to the patient, number one, both during the procedure and after the procedure. Number two, it can help us in completing difficult colonoscopies with angulated colons and with people who have redundant, or in simple terms we call floppy colons. So I'm happy to have primary care providers refer me patients who have previously had incomplete colonoscopies or difficult colonoscopies, because this technique can be very useful in helping us complete their colonoscopies. I also offer motility testing at Goshen Health, especially for esophageal motility. For this we do esophageal manometry, as well as we have an additional balloon testing device which is called an endoflip, which is a fairly advanced way of checking for any motility abnormalities during an upper endoscopy. We were the first community hospital in the whole of the United States to get the endoflip device in our system. I also offer a removal of the polyps using a full thickness resection device in which we can remove previously scarred polyps or even early cancers which was not previously done, and it's really unique to Goshen. I would strongly encourage all our primary care physicians to start colorectal cancer screening at age 45 for all the patients, or earlier based on their family history or their symptoms. I would encourage the primary care provider to talk to their patient regarding differences between stool-based testing and a high-quality colonoscopy, and tell them the differences so that they can understand that a colonoscopy is also a preventive test, because we can remove precancerous polyps before they turn into cancer, while the stool-based testing cannot do that. Adenoma detection rate is a marker of a quality colonoscopy. The higher the adenoma detection rate, the higher the quality of a colonoscopist. On average, the ADR rate for females is around 25%. For males, it should be around 30%. We are proud to say that at Goshen Gastroenterology, we have a very high adenoma detection rate of more than 50%. That should encourage our primary care physicians to refer patients to us, because we provide that high quality colonoscopy. I also do ERCP, which is an endoscopic retrograde cholangiopancreatography. Post ERCP pancreatitis risk is around 5% or more on an average in US, and I have an post-ERCP pancreatitis risk which is less than 1%. Patients have a very low risk and they can be discharged the same day and stuff without having any additional days or any other further complications to deal with. Goshen Health offers that patient an opportunity to get a one-stop treatment, we have a team of bariatric surgeons, we have general surgeons. We work very closely with them in a multidisciplinary approach, which is unique to the patient, especially for people with cancers. We get opinion from all the physicians in the specialty like pathology, radiology, the surgery, oncologist, radiologist, as well as myself as an advanced endoscopist. That's the best care that we can provide to the patient in an integrated approach, and so that we can get multiple aspects of the treatment, whatever is needed to take care of that patient.